National Education and Training for Health Policy, which was passed by Cabinet on the 6th of October 2025.
The Minister for Health, Dr. Chris Baryomunsi, has tabled on floor of Parliament the National Education and Training for Health Policy that was passed in 2025 to create a regulatory framework to streamline training of medical professionals. The policy sets standards to build competencies in the medical field. After the policy had been passed, Ministry of Health was directed to deploy all medical interns, hence expanded internship centers to 77 with 2,490 interns deployed. However, the medical interns contested the provision of facilitation in the policy. Now, Cabinet has recommended that the current cohort be facilitated with 1 million shillings allowances to help in their accommodation and feeding.
President, I have also consulted the Cabinet which sat yesterday. We did agree and the Cabinet recommended that we suspend that provision of facilitation for medical interns, meaning that we pay them as it has been. So going forward, the current cohort of interns will be paid the same amount. That is 1,268,929, and is subject to tax, and then the net pay will be 1 million. So that.
The leader of opposition, Joe Senyonyi, appreciates government, however seeks for a permanent solution since the cabinet recommendation is for the current cohort. He also advocates for an increase of the medical interns allowance from 1 million shillings.
Now, in your engagements with government, now that you're preparing a report, that you get to say, no, we need to, going forward, continue to facilitate these people so that it doesn't apply only to this cohort. So I hope it's not just for this cohort, and then going forward you say, no, we will not facilitate them going forward. The terrain is different. Many of them are in far to rich places. And so 1 million shillings or that kind of thing many years ago cannot be the same today. So please keep engaging them and let the conversation be, how do we facilitate them better? You have started now by acknowledging, yes, they need to be facilitated, but that needs to be improved. They're saying the work they do, things are expensive, the places they've got to go and rent are.
One legislator wanted to know the fate of medical interns who were arrested during a demonstration.
The detailed statement. May we know the fate, or whether there is something that has been decided by the government regarding those who have been arrested in doing what they are supposed to do under the Constitution.
I was briefing Parliament that day. I didn't know they were demonstrating coming to Parliament. And I think up to 8 of them were arrested, produced in court, charged, and remanded. As the Minister of Health, I will engage the judicial officers together with Attorney General to see how the issue can be amicably resolved. So those young people should be released so that they can go and start their internship.
The chairperson of the Committee on Health, Dr. Julius Mande, was concerned about the safety of medical interns.
It was reported last time, I think a year or ago, where some intern lost lives. And this was on account of choosing accommodation in insecure areas of stay. So I think the allowance that we give really needs to be stepped up such that these interns are able to choose accommodation in safer areas.
Going to work with the directors of the various hospitals where these interns are deployed so that we help with the management of the hospitals to get accommodation which is near enough and safe enough.
Meanwhile, the Minister for Information, Communication Technology in charge of national guidance, Alion York Odria, has presented a cabinet decision to the press at Media Center in Kampala in line with medical interns allowances.
As long as a person has been attending lectures for the 5 years, inclusive all other trainings within the 5 years, and has passed all his exams, then that student qualifies for graduation. Minors waiting for interns to pass the.
I'm Nafka Farida in Kampala.